So you guys let me know when I can start.
You're good to go.
Okay, excellent. Good afternoon. Thank you for being here. First time in a while I'm speaking in front of people, not just my laptop. And that's fantastic. So, I want to talk to you a little bit about FHIR. What it is, why it is important, and what you can do with it today. Okay? So, to start with, don't even bother trying to understand everything on this slide. FHIR can do a lot. It's a very important part of current healthcare interoperability. But one thing I want to take away from this slide is this last paragraph. That means it's not only good at doing certain things, it's now mandated by the federal government here in the US that every healthcare provider, every payer, every lab, and you, as creators of new applications, required for your applications to communicate health information in this FHIR standard. Like you might think about some new and breakthrough ideas in healthcare or how to improve patients' life and so on. At some point, regulators would start knocking at your door saying, hey, guys, we want you to support this standard. They already doing that for all the hospitals, all the labs, all the payers and providers, doing the same thing. You have to be able to exchange your data in FHIR standard. So, reality is in the United States, FHIR is standard mandated by the government, and every participant in healthcare systems already supporting that in one form or another. Right? I'm personally from Canada, and as Canadian patient, father of 3, and a taxpayer, I'm extremely happy that Canada is also adopting FHIR as a standard and not invented yet another pan-Canadian standard, but that's a run for another presentation. Now, did healthcare interoperability existed before FHIR? Absolutely yes. We had messaging standard, HL7 V2, which is pretty delimited strings. If you look at that, it will be something like from 1980s. Right? We had document, huge, humongous CCD documents with a whole bunch of OIDs that you need to understand and navigate. Not the easiest standard to deal with, but did the job for the time being as a matter of exchanging like consolidated information about a single patient, for instance. Right? And we had a whole bunch of services, commonly known as IHE profiles, that is based on SOAP and web services technology that would let you do something like search for patients based on demographics, get the recent results for this particular patient, and so on. Right? And we have different protocols. SOAP, MLLP, just pure TCP/IP protocol for exchanging this data. So we had all the interoperability already, but formats for exchanging that, the protocols for exchanging healthcare, the same healthcare information was different. What FHIR brings to the picture is we have single format that can satisfy all the use cases of interoperability. The message that you get with your lab results is the same message that you would get as your bundle with data about patient. The data that would be returned from your service, like saying, show me all these allergies for that particular patient, right, is the same data that was initially submitted by the doctor as an observation about the patient. Say, this patient probably have a shellfish allergy, twist, right? So, FHIR simplifies this business a lot. Single standard, single protocol, single payload, right? But it still satisfies all the use cases for interoperability. So based just on that, right, the fact that there is a federal mandate that health data should be exchanged in FHIR, and some use cases, we already came up with some basic picture of what FHIR can do for you, right? you have various players in the healthcare industry that must be able to give you data as FHIR, right? And you need some place to store it, some place to query it. The actor that usually plays this role is called FHIR repository. So basically, FHIR resource server that can collect this FHIR data, that you can query, that can respond to certain pattern of queries. Like there are more than 100 different resources that FHIR defines, and FHIR repositories, most of them support at least the basics, 20, some of them support up to a few hundred. And then on the other end, you have application that can consume data and that can interact with the same repository through the REST API. Right? But let's dig a little bit deeper into what FHIR is. Right? We know it's a REST. Right? So REST is most likely a JSON. And you are absolutely right. The basic entity in FHIR is what is called resource. Single resource can be healthcare related, can be environment related, can be business related. For instance, patient, observation, diagnosis, allergy. Like those are your medical resources. Then you have things like provider, payer, things like claim, so financial resources, and so on. In total, more than 100 different resources and a whole bunch of things that related to patient care would fit in the format like this. That's probably the simplest FHIR resource that you can picture, right? Single patient. All we know about this patient is name, gender, and date of birth. Like usually you know a few more facts about the patient, and like the resources would be a little bit more elaborate. But those resources can contain a whole bunch of other data. Another example is dog. Like, believe it or not, veterinary medicine using exactly the same standards as medicine for people. Like, as one of our customers, we have huge veterinary hospital in Saskatchewan, Canada, and I'm asking them, like, how is different? Like, oh, medicine is totally different. Like, try to lift the cow and make it, like, lay still. Like, no way you can do that. But in terms of healthcare informatics, it's the same thing. The only difference is we do use the species field, right, in our interface. And you can see it right here. Right? There's additional field in the patient that defines what kind of animal is this. Is it a dog? Is it a sheep or cow or not? Right? So there are a whole bunch of extensions that you can see in the typical resource that deals with a not necessarily standard situation. Right? This is how a very simple interaction with a REST service looks like. The simple REST call, what I'm doing is I'm posting the payload that you just seen on the previous slide, right? And the result of this call would be data about Darcy Johnson being submitted into the FHIR server, right? This patient from that moment on will start to exist in service. Right? Very simple. Now, another concept you have to understand about FHIR is bundle. Resources rarely exist in isolation, right? Resources can be linked to each other, and resources usually transmitted in more than one resource. Like then you go in and do your blood work, your doctor would put a bunch of checkboxes on your requisition form, right? And the result that would be returned is a bundle where against every checkbox you have some result, right? Giving you readings of whatever is going on with your blood work, right? Same here. So bundles can basically accumulate multiple resources into one entity. Like again, lab result is a very good example of bundle. They logically group together because it was a single requisition. Here's a single result. If you're searching for something, show me all the patients that have allergy to particular environment factor. Right? You get 5 patients, and the result will be returned as bundle. Dollar everything is very important kind of bundle, and that's enabler to a whole bunch of analytical scenarios. Dollar everything returns you everything we know about this patient. So every medication, every allergy, every observation ever made for that particular patient would be returned in one bundle. So basically, dollar everything tells you, for this particular patient, for Anton, give me everything you know about Anton. Now, think about that. You have data aggregated from multiple sources, from lab, from EMR system, from ambulances, from Fitbits, and so on, right? And then you're doing this request. Like for every single patient you have in your system, you dump it in the, relational database. You have yourself an analytical model that contains everything that your system accumulated about your patients. So this dollar everything is a key enabler for analytical use cases, analytical scenarios with FHIR, right? And a couple of last concepts that you might need to know about FHIR. Gender and date of birth are actually exceptions for FHIR. Most of the values that you see in FHIR are coded values, right? They're not just value that can be X or Y, they are value that belongs to a certain coded system, right? This one is observation about the body temperature, right? That's already coded value. We know that it's encoded in the system called Leon. There are multiple systems. Leon, ICD-10, SNOMED are the first one that came to mind, right? And things like body temperature, height, weight, common diagnosis, they all encoded there. There are people who day job 24/7, but who full-time job is the job of understanding this coding system and picking the right coding system that to use in your FHIR bundles or HL7 V2 bundles, right? And the value, right, it's again encoded. Encoded, we know 36.5, it's not just 36.5, right? We know that it's a body temperature in Celsius. If we'll change it to Fahrenheit, it will be somewhere around 100, right? So all, not absolutely all, but most of the values in FHIR are coded, and this coding system is extremely important. Okay? In fact, in FHIR you can encode pretty much any value you want, or any condition you want. Okay? You just create your own coding system. If there's nothing in Leon, nothing in SNOMED, nothing in terms of the standard stops you from creating your own standard and saying, I'm calling, I don't know, this entity, this number, right? All you need to do is publish it somewhere so other people have access to be interpret this coding system. But obviously the recommendation is to find existing coding systems that already have code for certain things, right? But if it doesn't, right, you might start on your own and create your own coding system. In this case, it would be not leon.org, but my own company and my own coding system. So you can encode everything. A couple of examples, right? COVID. Like when COVID just hit, we got a bunch of requests. Hey guys, does your system support COVID data? Right? What do you think the answer was?
Yes.
Yes, because there is nothing to support. Right? We support coded values, and it was a matter of waiting for Leon and for SNOMED to come up with emergency authorization for new numbers like this that would encode specific tests, specific results, specific diagnosis for COVID. Right? There was nothing for us to do, just to make sure we are in sync with these standard terminologies. Right? Another example is, what if I want to encode the data from my fitness tracker? Right? There is no such resource as fitness tracker or number of steps I did per day. Like, this is how you deal with that. Like, there is no SNOMED, there is no Lyon, there is no ICD-10 code for a fitness tracker, but there is this standard, like, that came up with like number of coded systems for things typically measured by fitness trackers, including number of steps, quality of sleep, and so on and so forth. Right? So this is how your observation would look like if you are to include code data from the fitness tracker. Like, just a different coding system, but this is the number of steps. Like, you need to do 10,000, you didn't do that. Right? Your physician would not be happy with you. Right? But this is what tells physician that this is a number of steps and not some abstract measurement of what have you. Right? Right now at Hackathon, you might not have time to find the exactly right coding system for what you need to measure, and I would say it's okay for now to make up one, your own, and later on just do your due diligence and find the right standard if it exists to encode what you need to encode, but please, whatever you can, encode as this kind of observation values in certain coding system instead of trying to put some silo on the side and code something outside of the FHIR. Right? Same thing, air quality, right? Environment sensor, right? How is air today? Right? You can put that into the same repository and later you can do analysis on how people with asthma are reacting to air quality, right? And do some correlations about that. Again, there is nothing new to invent for you, right? Other than maybe if you really sure that something like this doesn't exist for air quality, maybe then you create your own. Now, we started with the picture that looked like this. Okay? We have all the layers that mandated to send you the health information, right? We have FHIR repository and we have application, right? Now we know a little bit more about FHIR, we can extend this picture, right? Now we know that we can get data from all sorts of archive and previously unstructured data, right? Data from devices and sensors and your Fitbits and Apple Watch and so on. Apple Watch, by the way, already implemented all the FHIR that you need. Like sensors, bedside monitors, like little Raspberry Pis with little sensors connecting to that, right? Just encode that into observation, link this observation to the patient who puts his finger on the sensor. Like, and off you go. You'll have valid resource that everybody in the industry would understand. You would comply to all the regulations that you will be under, and all the other players in the healthcare environment will be happy. Now, instead of creating just application, rest you can automate some processes, right? If you get some data that is above certain threshold, you can trigger some actions, right? That can go. If you use something like $everything to extract data about the patient, right? You can do very creative analytical tools, right? You can invoke your machine learning, you can do artificial intelligence against this data. Just make sure data gets there, right? And again, all the big cloud providers already came up with their own version of analytical tools. Just you give them the dump of your JSON files and FHIR resources, they will give you a set of SQL tables and you'll be able to do SQL queries, do machine learning against them and so on, right? Now, all you need is this, right? And this is what InterSystems offers you at this hackathon. InterSystems FHIR Accelerator Service is a FHIR repository that you can get in the cloud, and within 15 minutes you get FHIR repository that can consume all the data that you need here, all the data generated by all these other players in the industry. Like, you can create your application right, with different methods of authentication, export data into analytics, and so on and so forth. So let me quickly show you how to get there and what do you get when you get there, right? I'll show you this link, right? I don't know if you want to take a screenshot, that's probably a good time, but I'll keep this thing hanging here. One of the links will get you right to the place where you create your own service. So let me go there on my machine. Probably see it for now, and put my glasses on. So, after you get to the system and create your account, you will arrive to the screen like this. The only difference, you would not have a single deployment yet. It would be empty. Right? I'm limited to one deployment, but if you want to create new deployment, it's literally a couple of clicks. Like create new deployment, I want to do that in AWS, you select the region, you select the size, and within 10 minutes you get yourself a new deployment. So let's take a look what you can do with this deployment, right? First of all, it gives you endpoint, right? One is for simplified access that I envision most of you would use for the purpose of this hackathon. Another one with the complex WAF2 authentication, right? Which enables you industry standard access to the highly secure way of authenticating patients. And for instance, if you're doing that with, let's say, hospital that already has their doctors and nurses and patients registered in something like Active Directory, you can use that to authenticate against your service without recreating all the patients, right? You have credentials, right? And basically, credentials can be either your auth2 users or keys, right? That give you right to access this particular scenario. So I can create one now, and 3. And so the first thing I'll do is I create the key. I can look at the key. I can copy it, right? And this string I can already use to access my endpoint, right? Remember the slide where I showed how to create a single patient, right? This is it. Right? If I'll do a request, like post to the endpoint that I just showed you, using the key that I just generated. I'm just using one of the previously generated key, right? And the patient as a payload, right? I got 201, that means resource was successfully created. Like, so if you are a developer and you deal with Python or Node.js or whatnot, this would be good enough for you as an example to follow and to re-implementing on your own. Okay. Another thing that you can find here is API development. For API development, you can click on Authorize and pass the key that you just generated. And after that, you can execute requests. Like for instance, I want, no, post is not what I want to get the patients. Like you can click on Try It Out and execute. Okay. Right. As a result, I got bundle that contains all the patients that I have in my system. Remember we talked about bundles, right? I got a bundle and I know I have 115 patients in my system. right? And if I'll keep scrolling down, I eventually would get information about all 115 patient resources, right? I can enter new patients, for instance, right? I can click on the post, and for the post it gives me a whole bunch of examples, right, of different patients. All right, and it has managed organization, and this is the example of relationships between resources in FHIR. Right? I can look at, let's say, observation. Again, look at the post, and I have a whole bunch of examples. And a very simple example would be body mass index. Right, it's not that simple if you look at them, but still, right, it has the POD system, which is observation category vital signs. It has the Lyon code, body mass index, right, and it has the coded value, which is 16.2 kilos by meters squared. I don't know what it is, but yeah, you got the idea, right? Whole bunch of samples here. You can right away try it out, post it, and it would be in there. Already while we were sitting here, a few people approached us and said, like, hey, Anton, show us how we can find all the allergies for a particular patient, right? Easy. Like every allergy has the, if we look at the allergy, let's authorize this thing. And again, we can start with trying every single allergy. Right, and oh, that's not the allergy data set that I loaded, right? Unless I'm doing something wrong. No, I'm not. Everything is going good, it's just empty result set, so allergy was not a good example if we look at let's say observations. And that's unfortunate, we have to reauthorize every time. And get all the observation, try it out. Execute. We have plenty of observation. Observation is probably the most frequent resource that you would have in your repository regardless. Right, and every observation would have like measurements, and it would have reference to the patient, right? So what you can do is you can say, I can go to patient and do the reverse include search, saying, show me all the observations for this patient, right? And it would give you patient and observations included with this patient, so you can do something like graphing the development of patient's body mass index or patient growth chart, right? Simple as that. So resources are interlinked. Like everything you do in an API manager, you can always get to the curl command that you can execute, and that will give you the results. So if you develop in Python or JavaScript or whatnot, there would be no problem for you to translate what you're doing here into actual code that you develop. Right? Now, a lot of people asking us, what about data? Where do we get data about realistically looking patients? Like, we cannot give you the real data without exposing us to the risk of a whole bunch of lawsuits. But what we can do is we can give you data for generated data for simulated patients. There is a tool called Synthia that can generate realistically looking data. And we generated and preloaded for you a whole bunch of data sets that you might find relevant for you. So let's go to show everything. So for instance, we have 55 COVID patients here. Like those are the patients who has specific code related to COVID identified as positive, right? We have patients with certain allergies, right? So I can say I want to do my COVID patients, right? I can upload this scenario. That will basically take it from the public as free bucket into your server, and then you're happy with the fact that you received 55 bundles, but you don't load it yet, you can start the import process. Right? So while import process is going, you can literally see like number of your patients growing. So it's 121 now, and as we go, it's 129, and so on and so forth. So if you want some realistic looking data for your project, like we got it for you. If you want to generate your own, you can use tools like Cynthia to generate them and load them into the system. Right? If you're interested in, I think the largest database I have in the public as free bucket somewhere is 100,000 patients. Right? I don't know what you're going to do with it, but you know, we have it. And if you need help generating your own test data, or maybe like one thing that I like to do in some of my demos is rename all the patients to something like Homer Simpson, Marge Simpson, and so on. Right? We can do that too. Like this, the data generated by Cynthia is FHIR bundles. You can go there, you can edit them manually, you can create some codes that you want, add them there, and go ahead. Now, so you've seen how to get your own FHIR repository, how to access that through API browser, through the command line, through Perl. Like if you're familiar with Perl or Python or JavaScript, you should be good to go with your own development. Now, let me show a couple more resources that can quickly help you to bootstrap your own development. Right? Those resources are, if you go into InterSystems OpenExchange, right, and the link is openexchange.intersystems.com, that QR code that I shared earlier has linked to that too, right? There are a few hundred different applications. If you'll just do filtering by FHIR, like there would be, what are those? 23 applications that are FHIR specific. More than half of them would work out of the box with FHIR Accelerator service. Like some of them are browser of the patient, some of them are auth2 authentication, and that's the most sophisticated thing that you can attempt. And honestly, I wouldn't recommend you to attempt that in 24 hours unless you really understand auth2 specification, because it's complex. It's not our fault, it's just like the entire thing is complex. It should be secure, and it's not easy to do, and keep it simple. Okay? Another area that you can look for inspiration is Smart on FHIR application gallery. Have you ever heard of Smart on FHIR? Any show of hands? So Smart on FHIR is the library and framework based on FHIR standard that is designed to quickly help you develop either web or mobile applications using FHIR. And if you'll go there, most of the applications you will see in this Smart on FHIR gallery, they open source. You can easily enable, I'll take it back, the easily part. Okay? You can enable them to work with FHIR Accelerator service, but they can give you some great ideas of what can be done with this information. Okay? Why it's not easy? Again, it's auth2. Authentication for Smart on FHIR is auth2, and unless you understand like different authentication scenarios for auth2 and the players and the role of auth2 provider and authentication server and so on, it quickly becomes confusing. If you are absolutely confident that that's exactly the application that would help me win this hackathon, all I need is to enable it against the FHIR Accelerator service. Go talk to us. We can guide you through the process. Right? But if you try that on your own, just be careful. I don't want you to waste your time just to figure out that you need to go back and learn what to before you start doing that. But that's the great source of inspiration for what you be doing. How are we doing with time? I think we're almost there. So,
we have about 4 minutes left, and if you want, I can start reading questions off the slide.
yeah, let's do that. I'll keep this QR code there. It has links to all the resources. And again, if you want to just get FHIR Accelerator, it's fairly straightforward. You go there, you use your Gmail or Gmail Plus disposable account, and in 15 minutes it's up and running. We already got a bunch of people asking us how they do certain things with their own copies of FHIR Accelerator in the cloud. Right? So it's as simple as it can be. Right? And like significant value that we actually bring into the picture is what you don't do and what you don't see. Things like security, backups, high availability, and so on and so forth. Like you can probably find some open source FHIR repository somewhere on GitHub and run with it, but we're doing way more that you just don't see. Okay, let's start with questions.
Great. So one question that someone had is, I think it said, how old is FHIR and what changes have you seen since it was first implemented?
It's not as old as I am, but my time with FHIR is not that long to make. I think it's around 10 years old. We are now at the version 4. We are getting close to the release of version 5. The new big thing in FHIR is FHIR profiles, and they are specific to the regions and to the applications. Like there is US profile, there is UK profile. So the next market that we going with our FHIR is UK, and we know that we need to implement specific UK profiles, but with the whole profile infrastructure is just pre-populated default values, not with US but with UK data.
Great.
Yeah.
Semi-related, another person asked, would larger healthcare institutions like hospitals have different access to FHIR compared to individual developers?
Yes, access is definitely different. I'm not going, I didn't go into that, but if you go in the proper and more complex authentication, which is OAuth2 based, like there's a concept of scopes that defines what you can and cannot see, and there are 4 different scenarios. Like there's a scenario, there's a patient-centric. Like Anton with his cell phone trying to get the data, we should make sure that Anton gets data only about Anton. Right? If I'm a physician, I may have rights to see the data about all my patients, or all patients in the hospital, right? But again, this is one of the things that makes OAuth2 based authentication complex but necessary.
Great. Yeah, and another question that was semi-related, someone asked, how is the FHIR system visually represented so it can be understood by doctors and other healthcare providers?
There is no visual standard or guidelines, right? There is a frameworks and API that let you build application, but it's up to application developer how they want to represent this data, right? Obviously, representation on Apple Watch would be totally different than representation on the desktop or radiology workspace with big ass screens.
Yeah.
So, but there's no data representation, visual representation standard. It's not part of it.
All right. And one last question I think we can end on is, has the pandemic affected how FHIR plans to move forward in the future?
pandemic validated that the way FHIR is going is the right way, because FHIR was able very quickly adapt and like seamlessly accommodate all the changes. And I already brought this example, but when COVID hit, like there's nothing in FHIR to change to accommodate that. We only needed to wait for Linux and other standards body to like say, this is the code that you use for this sample, this disease, this diagram, that's it. So it's validated that the FHIR is on the right track, and it significantly accelerated the adoption, right? Because like a lot of things moved to virtual, and exchange of data and secure exchange of data became way more important than it was before.
All right. Any other questions from the audience here or on the YouTube stream? All right. So thank you to InterSystems for coming out. Really great workshop. So thank you. And they will be holding another event later tonight. So tune into that one as well.